The coaching game. I'm Laurie Lawson, and tonight my guest, I am thrilled to say, and I told you all the tricks we had to do to pull this off, is Dr. David Hanscom. Thank you so much for being on the show.
Thank you very, very much for having me. I'm very excited about this.
David, I'm going to call him David. David is a spinal surgeon and a medical doctor and all of those requirements, who prefers not to do spinal surgery. And he's going to tell us all about the journey that got him there and the fantastic book that he wrote, which is called Back in Control. Let me first tell you a touch about the coaching game. The show is based on Points of View, the coaching game, and that is a card game that is designed specifically to bring right and left brain thinking together. And the results are amazing. And what I do is usually have my guests pick a card or a few that they think might get their message out a little more concisely. And David has chosen 4, so we'll see how many we get through. But first, David, I want to know, well, let me show them your book also while we're doing that. And this is Back in Control. And this is, explain to me, you said it's not a problem. It's not, you don't tick off, I do this, this, and this, and your back will be better. It's the foundation for...
Right. What the book does, chronic pain is a very complex topic. What the book does, it breaks chronic pain down into 5 different parts.
Oh, okay.
So it's simply a framework that helps organize your thinking about a complicated problem. There's 3 parts to it. Basically, you learn about chronic pain. The second part is you treat every variable at the same time. Then the third part is once you understand your situation, once you understand chronic pain, you take control of your own care.
Okay. All right. That sounds too good to be true, but we're going to find out why it really is true. So, first of all, tell me, give me a little bit of your background and how did this all happen? You're supposed to be sharpening your scalpel and cutting folks open. What happened?
Well, I'm part of a complex spine team at Swedish Hospital in Seattle, and I have been doing spine surgery for almost 30 years now. Mm-hmm. And a good part of my practice has to do with treating patients who have had multiple failed surgeries. And I've had one gentleman with 29 operations in 20 years, another gentleman with 20 operations in 48 months. The patients I get involved with are very, very complicated. And what happens, once you start that pathway of multiple surgeries, it's hard to salvage. I ended up in chronic pain myself for 15 years, by a very fortunate set of sequences that came out of it in about 2003. It took me about 5 years to figure out what happened. About 2006, 2007, I started sharing these tools with my patient. In about 2009, people started going to pain-free. And what's happening, we found out that chronic pain is a process of neurological programming. It's a neurological issue. The pathways that are created are permanent pathways that you cannot fix. They're also linked with anxiety pathways, which you cannot fix.
All right, don't get depressed. He's fixed them. He's going to tell you how to fix that. How to fix the unfixability, yes.
Once you understand that they're not fixable, then you can move a different direction and actually solve the problem. So you solve the problem by trying not to fix what's not fixable. So I was in chronic pain myself for about 15 years. I was totally lost hope, despair. I did not know what to do. Nobody told me about this. I was never trained about what to do. And it's become very, very clear that back pain in general is a symptom of what's called the mind-body syndrome, which chronic pain is basically due to an adrenalized nervous system, which changes the pain threshold. What I found out is I was doing structural operations for a neurological issue.
Now explain that a little bit more.
Well, in other words, there's over 600,000 spine fusions done a year in the U.S.
Oh my goodness.
And probably half of those are done for back pain. But the problem is back pain is probably a muscular issue. You're doing a bony operation for a muscular issue.
Oh, okay.
But it also turns out to be probably a neurological problem. What happens, we found out that if you take acute pain, it lives in the pain center. It's been documented out of a study out of Chicago that within 12 months, the pain center goes dormant, only the emotional center is firing. So chronic pain completely switches spots.
So you're not doing what makes everybody crazy by saying it's all in your head. Well, you're saying there's a scientific pathway to your emotional stuff.
Right. I mean, it's not. Yeah,
How technical is that?
Yeah. It's not psychological. I mean, the problem is your body responds to stress with adrenaline and cortisol, amongst 2 of the main chemicals. And of course, when your body has adrenaline, of course, pain is a stress. Pain will cause increased adrenaline, which says danger. which makes more adrenaline, but it amplifies the signal.
See, now that's something that I just learned from you today, because I'm thinking, oh, your adrenaline's fired and it's fighting. But you're saying, no, what it's really doing is emphasizing what is creating the adrenaline to rise.
Correct, is signaling danger and alert. And what happens, we get trapped by pain, we get very frustrated. It becomes similar to driving your car down the freeway in third gear. Your body's always adrenalized, you're trapped by the pain, you're pretty frustrated. Nobody's showing you.
It won't go anywhere, so you keep it going, but you push more and more.
Right, and so your body starts to break down.
Wow, great analogy.
Yeah, I mean, what happens with an adrenalized nervous system is actually over 33 symptoms of what's called mind-body syndrome from an adrenalized nervous system. At my worst experience around 1987, 88, I had 16 of these symptoms at the same time. I had migraine headaches, I had ringing in my ears, I had burning in my feet, I had itching all over my whole body, skin rashes broke out, and the list goes on. One of the classic symptoms of mind-body syndrome, which I think is the driving force, is anxiety. I also found out that mental pain and physical pain are processed in the same part of the brain. When we do our seminar at Omega, we treat the mental pain and physical pain as exactly the same thing. There's adrenaline involved, but there's also a linkage. In other words, when anxiety goes up, pain goes up, pain goes up, anxiety goes up. But anxiety is just a reflex that simply links you to the environment. That's how we survive, is by avoiding anxiety. When anxiety goes up, pain goes up, it's just an intersection of pathways. It's not psychological. And with repetition, pain pathways get stronger. As people get older, anxiety becomes stronger because of repetition. That's not psychological. You have a link to the environment called anxiety that causes a chemical response to protect you, which puts your whole body on alert. Right? You catch the drift?
Yeah, it's like
right. And so I had no awareness of this. I was in medical school, residency, my spine fellowship, probably 20 years in practice. I had to go through my entire extreme pain episode for 15 years before I figured this out.
That's amazing. And was surgery not an option for you, or did you try surgery, or?
I didn't have any structure. I mean, I've had 2 back surgeries for a structural problem. In other words, I'm not against surgery at all. In other words, if somebody has a ruptured disc, pinched nerve, that if we do the right operation, people do very, very well. I'm a very busy surgeon. Tumors, trauma, infections, major problems. But what we've also found out, which is extraordinary over the last year, is that I have in place what's called a prehab process.
I love that name, prehab, as opposed to rehab, yes.
And what's happened is that the data in the literature says there's over 1,000 research articles stating that anxiety, depression, and catastrophizing are negative factors for a surgical outcome. And the lack of sleep, that's a problem. High dose medications, that's a problem. What we decided to do is ask all of our patients, small operations, big operations, to treat the anxiety, treat the depression, get the sleep, stabilize medications, learn about chronic pain. We now have over 45 patients who have gone pain-free without the surgery with major structural problems.
That's just amazing.
I mean, I had one guy who came to me with a 4-millimeter spinal canal. Normally, the spinal canal is 15 millimeters in diameter. His is down to 4. He couldn't stand up because his legs were so sore. He was basically in a wheelchair for 4 or 5 months. I moved the surgery up to get him out of the wheelchair. Good guy, very active guy. And he developed a cold, and we had to delay the surgery. And I'm going, look, just humor me. I know you're not buying this stuff, but just humor me. Just do the regular.
You're not doing anything else.
So do the right exercises, do some relaxation, at least read the book. To make a long story short, he canceled the surgery because his pain went away. He's back hunting elk with a 4-millimeter spinal canal.
That is amazing. Now, how long did that take?
Yeah, his is about 6 weeks.
And okay, I'm baffled. I'm baffled,
Right.
and I'm thrilled that this is
Right.
that you're out here telling people this.
Right.
Can you tell me? I'm going to totally confuse the scientific stuff because I know nothing about it. So, is it a chicken-egg process? What comes first? Is it the emotional pain that causes the back thing? Because I've always thought that's something that is reflective in back pain, or is it back pain that causes? I know back pain causes the emotional pain. I'm sure of that. I've been there, but
It goes both ways.
so it's a cumulative effort.
Well, what we don't know, I mean, it doesn't matter in a way. I mean, even with a structural
Right, who
problem,
cares?
well, but I mean, think about this. I mean,
Yeah.
it's a great question because, again, mental pain and physical pain are processed in the same part of the brain. And remember, anxiety is one of the classic symptoms. So I wrote a little website post called, Am I Operating on Your Pain or Your Anxiety? And I had 4 patients 1 week, and this has been one of the biggest paradigm shifts for me ever, is that I see a structural problem, I'm going to fix it. Then I looked on the questionnaire, and it goes 10 out of 10 anxiety. Then I go, look, if I did an operation on this obviously structural problem, and I got rid of your leg pain, what would it be like to live with this level of anxiety the rest of your life? And they instantly grab their leg and go, well, by getting rid of the leg pain, will I help my anxiety? And I go, no, that's a separate deal. Then they go, that would be terrible. Then I go, well, what if I get rid of your anxiety and you had to live with this degree of leg pain the rest of your life? They go, of course, I wouldn't like it, but I could deal with that. But it turns out at the end of the day, and I went through an extreme anxiety reaction. It was horrible. I will use it, the only term I can use is a branding iron on my brain, but raw anxiety is intolerable. And what happens as we calm down the anxiety, you unlink the pathways, the physical pain really does drop down. But the interaction between physical pain and mental pain is so close that there's not much difference.
Okay, yeah.
So we really do treat those the same way. The fun part for me is why I enjoy treating chronic pain so much is that this is not about managing pain, this is about watching the pain go away. And then anxiety drops. People get remarried, they get new jobs, they become creative again. Because I think progressive anxiety as you go through lifetime just buries your dreams.
I'll agree. I mean, once you've had, and I believe the statistic is 80% of all human beings are going to have back pain at some point in their life. And
Right.
that's an astounding of
Right.
of statistics. But once you've had it, you can immediately sympathize with someone who has it because
Right.
it is like no other pain in the world.
Right.
So
Dental pain's pretty bad.
I hate that too.
Yeah, that's not good. Anyway.
Either way, we're not talking good stuff here. Yeah.
Right.
So so you're saying that normally our path is pain. We get crazy. We go to the doctor. We ask for drugs.
Right.
Drugs work sometimes, but you have to keep increasing the drugs because the pain is still there. And then where do you circumvent that whole thing?
Well, it's a sequence. In other words, the one thing in the book that I am obsessed about is sleep.
Okay.
In other words, 20% of the project, I'll just guesstimate here, of course, is that we use pain meds for pain, we use sleep meds for sleep. I get criticized for this as an orthopedic surgeon. I don't do this anymore because I'm not really in that role anymore. But when I started the project, I used lots of anti-anxiety medications for chronic pain. Short term, very short term.
Right.
But if you're being pummeled with pain, you're being pummeled with anxiety, you got to have some space
It's
to
pretty
work.
much all-consuming, and you don't realize it until it's gone, and
Correct.
it's like, oh my gosh,
Right.
I can sit again. This is amazing. Yeah.
Right. So the medications, so I do it backwards. In other words, when people come into me, I never take them off medications first. I never get into the narcotic thing. And I've had people on over 1,000 milligrams of oxycodone a day come off all medications, come out of the wheelchairs, go no pain medications, no pain. But they do it themselves. In other words, remember, the third part of this process is that they take control. Once the pain starts dropping, people really don't like narcotics. I mean, they have all sorts of side effects. People don't feel that good on them. Obviously, there's a few people that have addiction issues which get sorted out pretty quickly. But in the big picture, people really don't like being on narcotics. And then sleep, when you're in chronic pain, you almost always have to have medications to sleep. Same thing with the pain pathways. If you're trying to reroute pain pathways, but they're being reinforced like crazy with pain, you have to block that for a little bit.
Yeah.
That being said, we also know that if you have more than 100 milligrams of morphine per day, your brain becomes hypersensitized to pain. It's not just a tolerance issue, it actually changes the structure of your brain. And I didn't used to believe this, but I've seen multiple patients come off all medications and have their pain drop down dramatically off the narcotics.
So, are you saying that massive amounts of painkillers increase your ability to absorb pain, and therefore
Well, no,
pathways are larger, wider?
Well, no, it's tricky because I'm saying two things at once. So I think when you're on pain medications, that I just keep people on them. And as the pain decreases, the narcotics come down.
Okay.
But there's also a tipping point, and it's different for different people, but narcotics actually increase the sensitivity to pain. We call it upregulation.
Okay.
And when you start decreasing the narcotics, the actual sensation of pain decreases dramatically.
It's amazing.
And that's something new the last 5 years.
All right, let me ask you, how difficult is it to sell this to people? Because this is revolutionary. When I was in back pain syndrome and for 3 months, I wanted drugs, and at the end I wanted surgery. I didn't care what you did to me. So how, when people walk in, you go, oh, wait.
Well, what's interesting is that this isn't new.
No?
Dr. Francis Peabody wrote a very famous article in 1927 called The Care of the Patient. His point was the patient's on the ward in the hospital, the doctor doesn't know who this patient is. They don't know who he or she is. You don't know their home, their finances, their spouses, their kids. You know nothing. And his point is that if you ignore what he calls the emotional life, you're really not controlling the experiment very well. And so they're in the hospital, they have symptoms, and maybe they have stomach pain. You do all the tests, there's nothing there. Well, again, with adrenaline, it shuts down the blood supply to your stomach. His point back in 1927 was you have to know your patients. The problem isn't necessarily this is a new concept. It's become an old concept trying to bring back to life in the world of a very technology-oriented society. We're totally geared towards procedures. And this has been, and actually what's interesting, Dr. Peabody actually referred to Epictetus 2,000 years ago, who talked about the same thing.
Well, this is definitely not new then, yeah.
Right,
Okay.
but what's happening in modern medicine, we've gotten so obsessed with the anatomy that we have forgotten about the physiology, which means the reaction to stress,
Wow.
right? And so just because you can't see it on a test does not mean it doesn't exist. People in chronic pain become very, very frustrated because, quote, they can't see anything. Well, there's a very much higher chance that there's going to be a physiological response to stress than there is an anatomical problem. We really should be doing this the other way around, where the structural issues really are the exceptions. We should be surprised to find structural problems. We should understand that if you have stomach pain, why do $20,000 worth of tests when you should just calm people down first? If they don't respond within 2 to 4 weeks, then do the test. I mean, for some reason, we're just obsessed with testing, obsessed with structure. If we can't find anything, there's, quote, nothing wrong. You think about this carefully, it makes no sense, right?
You know what, you're absolutely right. It's like, well, and you feel there's a bit of relief. It's like, well, I've had every test known to man, and they can't find anything.
Right.
So then you go, it must be in my head, which of course it
Right.
is.
So
but-
that's a long way of saying that is, once people get involved with the project, like we talked about earlier, is probably 90 to 95% of people get better. But probably over half the people want nothing to do with this. So it's a difficult sell. And there's nothing I can do.
All right, what we need is, we need some concrete evidence.
Okay.
Give me some example. I know you got some.
So I just had one patient who's now a friend of mine who had broke his back about 8 years ago. He was thrown off a horse. And just a really tough guy. He spent 23 years in Africa working on an elephant preserve and really just a really solid guy. He fell off his horse, ended up with spine surgery to stabilize his fractured spine. Fortunately, he wasn't paralyzed, but he developed severe chronic pain. He had a second operation about 2 years later, which made the pain way worse. By the time he came to me in Seattle, he had 2 opinions that said he needed a fusion from his neck all the way to his pelvis, going through his abdomen and going through his back. And they said that's the only option you have. His girlfriend said, look, I've heard of this Hanscom guy. Let's go ahead and just get another
It's a
opinion.
little crazy, but
And so I walk in the room and go, Mark, I mean, there's no connection between disc degeneration and back pain. We know that. That's been documented in the literature. And your spine looks straight to me. I don't see anything to do surgery on at all. Then I said, look, here's the book. There's some simple negative writing exercises. You simply write down your negative thoughts and you tear them up. And what it does is not a psychological issue, it's just simply a separation process. Because the pain pathways and anxiety pathways are permanent. You cannot fix those. That's why it's an unsolvable problem. That's actually the solution. once you quit expending energy trying to fixing an unfixable problem, then you simply put your nervous system over here. And what you're doing, you're creating new pathways around the old pathways, but you're also shifting into different pathways. And he thought I was absolutely out of my mind. He's a PhD scientist. He goes, this is crazy. His girlfriend goes, look, this is your alternative, 10 hours of surgery, high complication rate versus riding. To make a long story short, within 3 days he was pain-free.
Amazing.
And a year later, he's doing fine. He's back riding his horses in the mountain. He's full function, no pain, no limitations. So you're looking at $200,000 worth of surgery with very high risk. By the way, when you do that operation, by the way, people still have the pain afterwards.
Everybody has I had back surgery, but it didn't work story.
Right.
I'm very lucky. Mine did, but mine was not a fusion. It was a herniated disc.
Which makes sense. I mean, that's actually an operation I do all the time, right?
Yeah, but all right, you know what? And yeah, I heard you mention Omega. I want to know where people can find you. And I know you're going to be doing a workshop soon at Omega, right?
I'm doing a workshop
Rhinebeck, yeah.
July 19th through 24th. We do it once a summer. The faculty is myself. There's a Dr. Fred Luskin out of Stanford who wrote a book called Forgive for Good. And by the way, I think I talked about you earlier, is that it's when that book came into my practice about 5 or 6 years ago, that's when people started going to pain-free. Because people in chronic pain are understandably upset and angry, and you have to let it go. Otherwise, you really are stuck. So Dr. Luskin is brilliant on forgiveness during that workshop, but the star of the show happens to be my wife, Babs, who is a professional tap dancer.
Okay.
She's a mime. She's been in clown school.
Oh my goodness, how cool.
And what she did about 2/3 of the workshop is simply rhythm and play and relaxation. And we have structured conversations, didactics about 1/3 of the workshop. What we found out that is essentially everybody in the workshop within 5 days went to pain-free, both mental pain and physical pain. We had 2 people come off all their bipolar meds after 20 and 30 years. They're still off the medications.
Bipolar meds?
Because remember, anxiety is a mind-body syndrome symptoms.
Yeah.
That's what drives bipolar. Right, again, you had to make the correct neurological diagnosis of anxiety, not psychological, then you can solve the problem. But it was an incredible workshop. We had another woman, 10 years of headaches and leg pain. Within 2 days, she's pain-free. She's still pain-free, doing fine. But what happens is that we found out that pain pathways are permanent, but so are play pathways. And you don't have to make those up, right?
Right.
Everybody has play pathways buried someplace, right? And I realized in my own experience that those are very powerful pathways. And again, you can reroute new pathways around the old pathways. And what the writing does, it creates an awareness and separation of the old pathways. And then we have a little process called active meditation, where you simply put your brain on sensory input and you shift to a different spot. Well, the play pathways do the same thing. You're shifting from these pain pathways into the play pathways. They're already there. They're very powerful. And people shared, they played together. And by the way, I think we talked about this earlier, but the essence of this project, it is not a formula. It's just a framework.
Right. So when you look at this book, and boy, do I recommend that you do that, Back in Control, you're going to get a formula, but not, what are they getting?
A framework.
A framework,
Right.
okay. Not the formula,
Right.
but it's going to set the whole foundation for you to, I don't want to say heal yourself, but for you to reconnect. Yeah, I like that.
Right.
So, and in this book, tell a little bit more. We don't have a lot of time, but tell us what they're going to find in the book. They're going to find, first of all, the theory behind all of this,
well, first of all,
science behind all this, really.
Correct. Well, we talk about, again, there's 5 parts. There's sleep, there's stress, medication management, physical conditioning, and then life outlook. That's the
Okay, now
framework.
let's say I read the book and I'm bouncing along and my pain goes away. Is that going to happen?
If you, I have an email from a patient goes, Dr. Hanscom, I read your book, I still hurt.
Okay.
Okay, when you read the book, it's not going to help, if you don't, unless you participate in the actual tool. So you have to go to your primary care doctor and get the medications to sleep. Remember, it's mostly self-directed. It's probably 90% self-directed. So I say,
You
look,
chose an authenticity card, and we talked about that, and it was authenticity, I'm going, what does that mean? And you're saying you have to take responsibility.
Absolutely.
Instead of going, please, doctor, fix me, and,
Right.
and do whatever you have to do.
Right.
So it's going to teach you how to take
Correct.
Responsibility. Okay.
Once you know the variables, it's not very hard. It's just not that hard. And that's, to me, that's the good news and the tragedy. So again, talking about this one gentleman, 10 hours of surgery versus writing exercises, And so I have so many people have had horrible spine surgeries done, end up being heroin addicts, the whole thing, versus simple relaxation exercises. It's hard to watch. I mean, that's why I'm here, is that I get to watch both sides of this at the same time. I watch these incredible stories every day, but every day I see people come to my clinic that have had 2 to 4 times a day. I see people have had major surgeries done that have made them way worse. Huge problem. So it's hard to watch this.
I would think so, and especially if you have the solution, you know,
Right.
and that must be very difficult. So let me ask, are you pain-free now?
Well, if I quit doing my own writing
Okay.
exercises,
Okay.
remember the pain pathways are permanent. I get my symptoms back in about 2 to 3 weeks, right? So it's a day-to-day. And the writing exercises, which you see on the website, are simply writing down negative thoughts, tearing them up. It's about 3 to 5 minutes every day. It's like brushing your teeth. It's not so hard.
Okay. Now, you mentioned a website. What is your website? I want people to know how to get in touch with you. They can read your book.
Right.
They can go to Omega
Right.
on July 19th.
Right.
How else can they get in touch with you? Because that's why I'm so thrilled to have you, because I know you're coming from Seattle.
Right.
So you're not New York City based. How can people find you?
Well, the website's back-in-control.com. It's a very
Okay.
self-directed website. I'm actually a full-time spine surgeon. I have 4 people in my pain center who do this for me now.
Oh,
They use the
okay.
same template. They're very excited about it. There's about 25 physicians around the country that do this. There are a few in New York,
Oh,
but there's not many.
Yeah,
And what we're trying to do is simply bring this right into mainstream medicine, because it's the root. In other words, we're probably spending over $1 trillion a year treating symptoms, when the root cause is this progressive anxiety and adrenaline. That's the problem.
That's just amazing to me. All right, so here's the plan. First, you're going to read the book called Back in Control by Dr. David Hanscom. And then I would say, and simultaneously, check out the website, because I'm sure you have tips on there. And if you need a referral to someone in your area, maybe you could help on that.
Right.
Is that right?
Right.
Yeah. And then if you can find him in real person, it's just fascinating. And if you're in
Right.
pain, you know, we have less than a minute left, believe it or not. This went so quickly, and there's so much more to talk about.
Right.
What would be, if you had to nutshell it down, what would be the one piece of information that you want to get out there?
Please be open, be curious, be open-minded, and simply engage. The data supporting this is way, way higher than treating the symptoms. And it's a remarkably consistent process. It's not something you're going to try and see what happens. At some point, you will change. If some reason you don't want to do this, you have to ask yourself why.
Interesting.
What's the risk? You're going to
Yeah.
learn something, and there's 0 risk, and it's a powerful process.
And what? Yes, and I would say that also. I would say it's like, what do you have to lose? First, try this, and
Right.
then we have the alternatives if
Correct.
you need it. I can only thank you so much for being
Yeah,
on here.
thank
I have
you.
learned so much, and I'm dying to finish your book, because I have to confess I didn't finish it, but it's
So-
great. Read it. Thank you, Dr.
Thank
David
you very
Hanscom.
much. I enjoyed it. So thanks.